Zilber, thank you for joining me on this Zoom. I was just asking you before we came on how long you've been in the clinic, and it's since April, so going on about 8 months. It's been an amazing journey for you. I initially met you and you were practicing just with physical therapies. You were a medical massage therapist, and now you're studying as well to be an osteopath. But having gone to you myself for my hip, a lot of what you did at the time was actually and felt like going to an osteopath. So I'm curious about the medical massage therapy. What is that, and can you tell us a little bit more about what you do at the clinic?
Well, medical massage therapy is a 2-year course that I did. It's I did it 2 years to become a senior therapist. It allows me in my country to work with hospitals, so I could open my own place inside a hospital and work away. So technically, I work with injuries, I work with rehab, I work with pain. I look at the body as a whole, trying to figure what caused it, and then just attack that and try to help the client get better.
From a physical perspective, the similarities with osteopathy at the time were really clear to me, because I go to osteopathy anyway. You were working at the time with the fascia. I found that really fascinating. There was such a release, specifically with pain, and also then with just the movement and everything else as well. Your field originally before that was in the strength and movement field anyway, wasn't it?
Personal trainer, yeah. Still is. I still do both.
Which kind of,
yeah, I started as a trainer, yeah.
And it kind of lends itself to one another to a fair degree anyway, do you find? Or
Oh yeah. As a trainer, I started working with, instead of getting people fit, I started to work with the people that find it hard to live their daily life because they have some kind of restriction. So I started working with them, and from there to being a medical massage therapy, the path was very clear to me.
Yeah. Do you find that there's a lot of similarities between what you do and what you would see someone doing chiropractic and osteopathy and everything else in Ireland? Would you see similarities with that?
I do hear a lot of feedback from clients that they get the same feeling.
Yeah, that was what surprised me so much. I was just taken away by that. Who is coming to you? Who are your clients?
Anyone and everyone who thinks he needs some kind of improvement. If he's feeling pain or something, if he has post-injury, post-surgery, I can probably find something to do with it.
Is there something that's coming to you more than other things? Like, I know that in the last couple of years, of course, people are sitting down an awful lot more, and because they're working from home, and the people are on their computers a bit more, or just watching TV. And of course, we're not working out as much as we used to in a lot of cases.
Unfortunately.
Yeah, very much unfortunately. So we're becoming more sedentary than we already were, and we really were already to a fair extent. Do you find that a lot more people are coming to you with like conditions related to their lifestyle now?
Mostly back pains, shoulder pains, and carpal tunnel syndrome. Yeah.
Oh, carpal tunnel. Okay. What is carpal tunnel syndrome?
Basically, since we're all day here and our hands are moving, and that's not a very natural movement for us, for the wrist. So we have a lot of, all the muscles above are just starting to feel a lot of strains on them. Yeah. So all the tendons start to get a little bit bigger, and just all the whole system starts to collapse. So people start to feel pain with their wrists and with their fingers, and they start to feel numbness and tingling. And the road from here to doing a surgery, if you don't go to someone who actually knows how to diagnose you well, is really short. Because if you go to, I won't say bad things about a lot of other professions, but if you go to certain professions, they would say, "Oh yeah, you have carpal tunnel. Let's give you some medicine, and when it doesn't work, let's send you to do some surgery to open it up." Instead of, let's see, maybe it's your muscles. Let's relax them, see how it affects you, and get you better in a matter of days rather than in a matter of months.
What we're kind of looking at, I suppose, to a fair extent about what you're doing specifically is finding the root causes behind what the issue is. I think
trying my best.
Yeah, and I think that that's something that is often, skipped over, is that there's a reason behind what's happening with you. There's a reason behind your back pain. There's a reason behind the pain that's going on in your hip. Or I find it fascinating that anytime that I feel that my lungs are tight, it has more to do with my hips and everything else than that. And my shoulder pain has so much to do with my hips, which actually has to do then with my feet. And I just find that fascinating that you're working on different parts of my body that aren't actually related to where the pain is or where the discomfort is.
But you still feel it where the pain is, even though we work in a different place.
Yeah, exactly. So finding out the root cause of something is a big part of what you can do, and what I've seen you doing with people. We get some incredible reviews coming into the clinic for you, specifically that are where someone has been in pain for a very long time. We could be talking years and years of pain and discomfort and stress and all the things that go with that, and then they spend some time with you. Obviously nothing, Rome isn't built in a day, but it's they spend some time with you, and things start to move in the right direction, per se. One of the things that we talked about a fair bit, I think, at the start was the fascia thing, and you might give me a little bit of the science behind working with fascia, because it is fascinating.
You thought a lot about this one, didn't you?
I was up all night writing that one. So it is interesting. It's something new as well. It's almost like it's not new. Someone didn't build it recently in a factory, but it's something that we're kind of looking at more closely now, I think, than before, certainly.
Yeah. Well, until now, a lot of, still you have a lot of therapists and trainers and people that work with the body that see the fascia as just the sheath to hold the body together. But recent research shows that it's not just the sheath, it's also how we move ourselves, and how, it's a whole internal system for feeling stuff. So we don't only have the brain and our nervous system, this is also part of that system. It's faster to react than what we think, and it has a big part of everything we do.
Oh.
Yeah.
And what happens when something goes wrong with that?
Then the fun starts, So the example that was given to me when I was a student and I was taught about the fascia is like, if we wear a shirt, and we're gonna hold it from the back and start to circulate around itself to create some kind of a sore spot or a trigger point, if you want. So the whole shirt is just gonna really tight in the front, but the issue is actually in the back. So when we start, same goes with the fascia. So if we're gonna move around and there's something that's holding us back, it's going to be a little bit more restriction, and all the muscles are going to have to work a little harder. And then it's just a chain of events that's going to lead to pain. So I might have a little strain in my hip fascia, but I'll feel it in my shoulder, I'll feel it in my head. And you just got to build it and try to understand exactly where it's coming from.
What happens? What system do you go through? If you could talk me through when someone comes in to see you, what you would test, what you would
First, I want to hear the background. What do they feel it? When do they feel it? Do they feel it all the time? Do they feel it when they sleep? Is there something that helps them to reduce the pain? Afterwards, I'm going to do my own testing. So if he comes with back pain, I'll do some testing to see his legs. Maybe we have a little bit worsening when he's doing legs. Maybe we have a little worsening when he's doing something with the upper body. I'm gonna put him in different positions to try and trigger the pain and work with what we find. So if someone comes with back pain, I can work the back, but that would just be putting a Band-Aid on it, and he'll come back next week. I still feel the same thing. I don't want that to happen.
Yeah. But that's what we've been seeing. We've been seeing like that changes are happening rather than someone just getting, maintenance. And there's a big difference between someone coming, once a week for a long period of time, or someone coming once a week for, 2, maybe 3 weeks, and then once a month, and once
then he's on alone. Yeah,
it's a completely different story. Because maintenance means there's something not fixed. I think if you need maintenance like on a weekly basis, there's something going on that hasn't been looked at more closely. And I think that what I noticed about you is that you also included some range of movement exercises and some stretches that were relating specifically.
Education.
Okay, I learned a lot in those sessions. And I'm still, I haven't seen you as a patient for such a long time because I've been doing the exercises that you showed me. And what I love about that, and what I feel is so great about that, is that I'm empowered to take care of myself. And once you start to learn that you can take care of your own health in your own body, it's really something that you run with. You kind of go, okay, there's something else happening here. Maybe I can work with that too. And it starts to change your perspective around things. So there's a lot of that happening as well, from what I hear from the reviews that we get from your clients specifically, that they're being given tools to take care of themselves in the future as well, which is a huge part of it. There's so much happening in the body. What we don't need is that extra thing going wrong. You work with a lot of different varieties, and do you find that hip pain is something that's there a lot?
It's usually involved with back pains, yeah. But if we're going to go back to what you said about me giving exercises, so one of the things that I usually do, if you'll come to the clinic, you'll see I always have a roll of TheraBand. So even if a client comes in and they don't have anything to work with at home, I'll give him a piece of TheraBand as part of the treatment and tell him what to do with it, because education is very important. I can treat you all the time, but if you're not going to treat yourself, it's not going to be worth it.
I actually recently bought myself some of that band of different strengths, because it is just, talk about increasing your range of movement. I get tight in the shoulders here, and I found that using something stretchy and elastic like that was something that started to make a big difference. And I would have gotten exercises from you for the hip side of it as well then at the time, and it's just amazing to work with. It's I think it's underrated, isn't it? This whole idea of using a bouncy elastic to stretch.
We all want to make money, so if I'm gonna send you home nice and healthy and you can do yourself good, I'm gonna be losing money, but I want you to feel good, so.
But yeah, it works. And I keep on looking at the ads that come up. When you buy something, they send you 1,000 more commercials about it. So I've been looking at all the ads coming up, and there's some. I think there's a lot of things moving away from the heavyweights and moving more towards the sort of different strength and different tensile of elastics and things like that. So it's interesting. It's definitely healthier than just lugging a weight around all the time if there's something going on, if there's something wrong. But yeah, we are seeing a lot of hip issues, I think, in the clinic at the moment as well, and I think some of the other therapists are working with that as well. Andrea in the clinic that does physical work as well, she works with a lot of hip issues and that. So it's definitely something that's around probably at the moment, and probably again from people sitting down.
Yeah, not doing anything during lockdowns, and then just it's fun not to do, so why go to the gym or why go outside if I could just sit at home as well, because I'm so used to it by now.
I think we've all gotten so used to it by now. It just feels like the normal thing to do. What if you yourself, obviously you're working out in the gym and everything else all the time yourself, and do you suggest specific workouts to people as well, or just stretches?
No, specific workouts. Depending on the case, I would build a program to whoever is in front of me to do in order to help him do what he needs to do. Because I can't separate me being a therapist and me being a trainer. They come together for me. So I treat the pain and then I train, or I train people, I find pain and then I bring them to treat them. So they walk hand in hand all the time, the whole way.
Do you work with people from a sports perspective, or was that something that you would have done in the past, getting somebody more flexible for their sport or fitter?
I had those. I had one of my clients was a gymnast, and like top of the line Europe competitions and all those, and she came to me after a long chain of doctors and professionals that weren't able to help her. So I gave my eye and we started a little process, and bit by bit we built her up back to where she was supposed to be with less injury. Now I'm not saying the injury is gone, but she can operate better with what she has.
That's amazing. That's fantastic. And I would see that from what we're hearing from other clients, that they're reporting, it might not be in the sports field they're working in, but they're reporting that they're A-okay, and that the issue that was there is certainly decreased, if not gone, in a lot of cases from working with you over periods of time. The next year, so 2022 is coming up. You're going to be continuing your studies in osteopathy as well as working with clients in the clinic. Yeah, it should be a good year. It should be interesting. We're hopefully going to be able to continue to grow and develop all the therapists in the clinic. But I would see that over the year, it should get fairly busy for you as well, because we're seeing a lot of people with the issues that are consistent throughout society at the moment. The thing that I find is very interesting about what you do specifically is that there's such a tie-in with the physical and the, what would you say, sort of stress levels that people have, you could say emotional. So we're seeing a lot of people with stress in the clinic. Obviously, there's 6 psychotherapists working in the clinic, and acupuncturists and everything else that work with stress to a fair extent anyway. And now we're seeing that people are having physical issues. If the stress is long term, they're having physical issues relating to the stress. Are you seeing that as well? Is that something that's coming to you?
Oh yeah, all the time. Stress makes people very, very tense and then you have to just start to take the tension out of their muscles and take the tension out of the structure so they can actually relax completely, as they should be.
Yeah.
They come in all like, I don't know, I have something here. Well, I do know you're stressed. Relax. It's only fine.
We're stressed, in fairness, we're stress heads at the moment anyway. You know, there's so much stress going on. So there's no shortage of people having this. And the way you described it is right. It's like, you know, so how would someone get to know more about you? How would someone learn more about you or make the choice to book you? What would they do?
Well, they can look me up online, see all the stuff I've learned and all my education, some of my experience. It's all in my site. It's all in my Facebook. It's all in my Instagram. I believe in being transparent. What I do, I put it online. If I didn't do it, it's not going to be there. So it's just there.
Yeah, you had, even before you started in the clinic, you had an extensive list of videos for people to show them what you do, and you've been adding to that since you started in the clinic as well. So we see your videos popping up on Instagram and Facebook every now and then as well. So Zilber's Way is the way to find you on Instagram and Facebook, isn't it? And then
also my site, yeah.
Your website, yeah, exactly. But then they have you in thenaturalclinic.ie, of course, as well. So Zilber, thank you so much. We'll be talking to one another again soon, because these are going to be regular things. So we'll be checking with some specific symptoms and specific conditions as well. So
all right, yeah, I'm still here.
Brilliant. Talk to you then. Take care. Thanks, Zilber. Bye-bye.